I need to move on to something. The Standard's website had this particularly alarmist report yesterday that said Nyanza had the highest number of gay men in Kenya. As it turns out, that was completely rubbish, and the data was disowned by the National AIDS Control Council, NACC, that had allegedly provided the data. NACC even asked the Standard to take down that story because it was misleading and inaccurate. But it was already attracting a lot of attention online. I was going to show you that video, that particular report. I will later. But let's now bring in some informed perspective from Leonard Mutisia from LVCT. And he's a gentleman who perhaps should be familiar with these because you used to work in Nyanza. Yes. As the head of men, I think, health rights for men that have sex with men and things related to that.
Yes.
Is this true?
Yes.
Okay, what is the whole report about the highest number of gays? Because that was the big banner headline that was out there. The highest number of gay men being in Nyanza.
In 2010, there was a population-based survey that was done on population estimates and HIV incidence and HIV risk factors regarding men who have sex with men. And this survey was done in Nairobi and Mombasa. And this is a survey that was released last year by NASCOP. It was commissioned by NASCOP. And the population estimates from that survey were 4,000 in Kisumu and around 10,000 in Nairobi. But the second survey, like you rightly said, has been disowned by NAC. And so, yeah, we probably don't need to make a comment on it. But the last survey that was done was actually in 2010.
But the bigger problem, which perhaps was completely misinterpreted by this reporting and which was missed completely in the furore that followed, is that there's genuine health problems in this sector of population.
Yes, yes. And I think that's really the more important issue. We should be discussing why is it that we need to be discussing men who have sex with men and not so much how many there are.
Right.
I would like to acknowledge from the last report that the main issue we have is that the HIV prevalence in the community of men who have sex with men is anywhere between 14 and 18%, which is double the national prevalence. And this supports findings from a 2008 modes of transmission study that told us that 15% of new infections actually come from men who have sex with men. And we need to ask ourselves, what are the key issues? We know that men who have sex with men do not get targeted testing opportunities or targeted STI management because we're in a generally homophobic country, a country that has a lot of stigma in healthcare services. We know that men who have sex with men don't get the right commodities they need for safe sex, condoms and lubricants. We know that they don't get the right form of counseling often. We know that also the political environment and the social environment is not very tolerant, and so they don't have an opportunity to actually even have support groups. And there's also gender-based violence, sexual and gender-based violence in the community. And these are the issues we need to be discussing, because those are the issues that actually increase the burden of HIV in the community.
How big are the health risks we're talking about here, or the exposure?
What do you mean?
In terms of men who have sex with men and the kind of health risk they're exposed to sexually especially?
The main risk is actually unprotected anal sex. And unprotected anal sex is a most risky form of sexual intercourse. It has the highest probability of actually transmitting HIV. And unfortunately, a lot of men who have sex with men do not have the correct information about safe sex and often engage in unprotected sexual encounters. In fact, in that 2010 study that I referred to, 3 out of 4 men who have sex with men inconsistently use condoms. So that's a big challenge. We need to find a way to create a safe environment where we can actually discuss this issue, so we're able to target them with safe sex. Safe sex messaging. Are
there facilities that offer these kinds of services, whether in Nyanza or all across the country?
Yes, there are. So there's facilities throughout the country that are supportive. A lot of programs in Kenya are very progressive and have decided to provide HIV services without discrimination. I work at LVCT and we provide non-discriminate services, but there's also a lot of other private programs that provide services, and the Ministry of Health has actually been leading this effort. NASCOP has really done a great deal to make public health hospitals tolerant spaces, and they do this in collaboration with programs like LVCT.
That said, perhaps the reason why it's so much harder for these people to access services is because as a society, there's still a lot of stigma associated with this, as you rightly mentioned, and therefore you're not going to walk into Kiambu District Hospital, you're not going to walk into Kericho District Hospital and get the kind of services and the kind of help you might need.
Yeah, yeah, that's true.
Is this something that over time, has it improved, has it gotten worse?
I think the beauty is that Kenya, there are Kenyans who are very emotive and hateful, and because there's reported incidences of violence, corrective rape, and just mob justice. So there are cases of that, is threats to violence. But on the whole, Kenyans are actually very tolerant people. And also we have a very supportive Ministry of Health, which has decided to actually prioritize HIV interventions that target men who have sex with men, female sex workers, and intravenous drug users. Because even though these populations might be very controversial, they're populations that contribute greatly to maintaining the epidemic, and unless we challenge them, then...
How can you say Kenyans are very tolerant when Nyanza has been trending on social media, on Facebook and Twitter for the longest period, since this report came out actually, and a lot of the comments are very insensitive, a lot of the comments are ignorant and just plain stupid? Yeah.
Well, like I said, there are isolated cases of violence and threats of violence, but on the whole, I think there are more intolerant countries too. So we're not there, but I think over the last 3 or 4 years, there's been an upsurge of programs that are becoming more and more tolerant and more inviting, and public health systems are more supportive. And yes, I'm sorry, is it wrong for me to be optimistic? I think Kenya is increasing in tolerance.
It's a good thing.
Yes.
If we lived in an idealistic world, what kind of systems would we need to put in place? What kind of mentality, change of mind that would we need to make sure that people don't die because of the choices, the sexual choices, which affect the diseases they have or how they get treatment? Yeah.
I think programs like LVCT are...
You've done a lot of plugs for LVCT. I will send you an invoice.
Programs like LVCT are concerned about driving Kenya towards universal healthcare access without discrimination. And I think that's an attitude we need to have. With regards to health, we should not be moral, we should not be judgmental, we should not have stigma. Let us provide support to everyone, because we passed a constitution that guarantees a right to health, which includes the right to sexual and reproductive health to all Kenyans. So if we could just stop discriminating, stop hating, and provide care to everyone.
Because I told you this in advance, and the minute this comes up on a platform such as this, then you expect some kind of response.
Yeah.
Like I said, for instance, and I was telling you on phone, there's so many cliches around this. I am a man who's from Nyanza. I'm also straight. But there's every joke that happens to be on the internet right now is about this. And I'm going to ask you, for instance, you do this because what is your sexual orientation?
Those are two different questions. I do this because HIV is actually a serious issue.
Right.
It is a national disaster. In Kenya, still is. We have more than 2/3 of the people who are infected with HIV are not on treatment. So I do this first because HIV is a serious epidemic.
And second?
You can ask the question.
Are you gay?
Yes. And
the reason why I ask this is because people then will begin to profile you in a certain way. Because you're gay, then you need to be talking about LGBT issues.
You know, I think my experience of being a gay Kenyan does add some value to my work, because I have a personal appreciation of the struggles and the frustrations of other gay men in trying to access services, and not all of them have the confidence that I do, or have the blessing of being in a supportive environment. But I mean, it's, and that's where it stops.
Because the question I'm driving at here is, the average Kenyan, moralistic or not, will say this is un-African, so why does somebody decide to be gay? So they deserve to be dying because that's a problem. It's a lifestyle choice.
Well, it's hard for me to make a response to that. We know that globally there are homosexual tendencies in every country, and even within the animal kingdom, even across species there is. So it's a difficult thing. I don't know how to respond to that. So we know that there are homosexual tendencies throughout the country, and some people are gay and some people are straight, and that's just what it is.
Let's bring this conversation to a close. Your final words. It's a blank canvas. You can say anything.
Thank you for giving me the opportunity
My
to come
pleasure.
in, and don't kill me for doing this one more time. But if we encourage you to come out and test, and if you know your status to be positive, come out and access treatment at LVCT. If you have any questions, anytime Monday to Monday, 8 to 8, you can call 1190 if you need any advice. So it's a toll-free number with Safaricom, and we can get free counseling, or you can come to our service center.
Mutesi Leonard from
Yes.
LVCT. Asante sana.
Thank you very much.
Thank you for coming on the program.
Thanks.
This is a conversation we needed to have. I will not make any apologies for having had it. And we're going to go on a short break right now on The Trend. We'll be back with Wairi and the top 5. Stay with us.